All right, so in doing our musculoskeletal assessment on a patient, we would first and foremost want to perform hand hygiene, don clean gloves, introduce ourselves to the patient, and inform them on the procedure in which we want to perform, and make sure we have their consent to do so. Starting out, in each step of this assessment, so each body part, we would want to first and foremost do a visual inspection, and with that visual inspection, we want to note their skin signs. Is it, pink? Does it look like there's good perfusion? Is it, necrotic tissue? Is there any mass or abnormal growths? Swelling, redness, bruising, bleeding, skin tears, all these things we want to know, and we want to be able to assess the patient without causing them additional pain. So a visual assessment is always necessary to be done first, also so that we don't manipulate anything and change it. So first and foremost, always assess, noting anything abnormal. So going through, what we would want to do initially is to note also if all things visually are symmetrical. Skeletal wise, our shoulders symmetrical from one to the other, and is their iliac crest, when you're looking from behind, is that symmetrical? Is the spine running straight with the normal curvature at the lumbar spine, which can be a little bit exaggerated in pregnant people or the obese population. So it's all things that specifically you want to be aware of. Also, with their hips, taking a look at their leg length. Is that symmetrical, or is one leg longer than the other? Is that normal, or did they dislocate their hip or break it? So all these things that you want to visually inspect and see first. Make sure that we aren't going to cause additional harm to a patient. Maybe they've got ecchymosis in the abdominal area. We won't know anything. We won't know if we're going to cause more harm unless we first see and take a look first. So after our visual inspection, then we'd go into our next steps, and we'll go and do that through each one of the body parts now. Starting with the hand, what you want to do is make sure that you visually inspect the palm and dorsal side, noting all fingers are there, the contour, is there clubbing. These all could be good indicators of maybe other chronic illnesses or diseases that the patient might be going through or have been dealing with for a while. And so after going through and doing your visual assessments, you're going to palpate all the bony prominences, make sure that everything is intact, nothing is moving, you're not able to manipulate it. And then moving into the wrist. Also noting that while you're manipulating these things and palpating, that you're not causing them any harm. I mean, for you and I, it should be pretty obvious. None of this should hurt. So it should not hurt on our patients as well, unless they have an underlying issue. So that's why we do our palpation. And after palpating, you'd want to go through range of motion exercises, which you saw with the hand in our range of motion video. Flexion, extension, hyperextension, doing it with the fingers, the phalanges, and the wrist here. So you just want to make sure that nothing abnormal is going on there, no crepitus, no nodules or swelling, and that they're able to complete everything within expected normal range. So after going through and completing your range of motion exercises, you can also do a kind of strength exercise where you're applying posing force to those range of motion exercises, and that being, let's say if we wanted to test hyperextension, can you push? For flexion, can you squeeze? All those things you could easily test to check the muscle rigidity of patients, and tone, make sure that everything is within normal range. And then also after going through and doing your hands and checking range of motion and strength, you'd move into the wrist, doing the same thing, bony prominences, range of motion, inspection, and obviously as I'm palpating, making sure that there's nothing, and once again within normal range. After going through and doing your wrist, you'd kind of palpate the rest of the way, feeling ulnar side here, radial side, nothing hurts, there's no break, nothing's moving, muscle tone and structure, everything looks normal. Then you'd move down to the elbow, and in the elbow, you'd want to once again palpate, noting if the patient is able to do normal range of motion, flexion, extension. There is no hyperextension. You could do rotations there. And then after doing that and checking the epicondyle, you would want to go and then move into going to the shoulder. Once again, palpating the whole way. You're feeling muscle tone and structure, no bones, no breaks, no pain, no swelling, no bruising, and there is no popping. You're not manipulating anything here per se, so you just want to make sure that what you're doing and touching is not causing the patient any harm, and everything feels normal. There's no abnormal masses, and you're feeling everywhere. It's a very uniform assessment so that you don't miss anything. You want to feel all their bony prominences, make sure it's normal, all the structures are normal. And then after going through and palpating for the shoulder, you already did your visual inspection. You want to then do range of motion, circumduction, flexion, extension, hyperextension. Go through all those motions once again, and then moving from your shoulder, you then want to go and take a look at the temporomandibular and do the assessment there. Sternocleidomastoid mastoid, assessing, palpating, visual inspection, and then you want to also go into, checking the trapezius, which we did as we were going from the shoulder up. Once you get into range of motion, can you thrust the jaw forward? Can you go side to side? Is there, as you open it, any popping, locking, or dislocating? Is it causing them pain? Many people have a popping noise when they eat, and it's totally fine and normal just so long as it's not causing them pain. That would be of concern if it was TMJ or something going on there. You can also at the exact same time kind of take a look at their oral health and other things. Make sure we've got the pink, because you always want to take a look and make sure that we've got good perfusion and health. Oral health is just as important as everything else. So you want to make sure that, there's no teeth loss. For your strength, can you, clench down on your teeth? Also, Once you get into this area, you can see muscle tone in their jaw. Does everything seem right? No manipulating it. Structures are in place and good and solid. So you'd like to assess all of those. After going through and assessing there, what you'd want to do is then move into the cervical spine. And with the cervical spine, you want to, once again, inspect, palpate, and in the inspection, we're doing the visual inspection, making sure that there's no deviation in the spine, that there's no bruising, and it's no obvious deformities or a mass. And in doing so, while you're palpating, you're going to go and feel each vertebrae and in between, and everything, is sound, and it's not causing the patient any pain, and there's no tenderness, there's no step off or crepitus. All very important when you're palpating the spine, especially, C5, stay alive. You gotta make sure at least everything from there is good. But then after going through and doing your visual assessment and your palpation, you want to move into your range of motion. Laterally, how are they doing? Flexion, extension, hyperextension, is that causing any pain? Are they able to do it? If the patient can't bring their chin to their chest and they've got some flu-like symptoms, oh my goodness, do they have meningitis? So, making sure that what normal range is very important. Noting that, the patient should be able to go about 45 degrees or 30 degrees front and back. It's very important to know these things. And then also, while you're going through, you want to do the opposing force or range of motion to test muscle strength. Make sure that they are able to go against some force. And that you should easily be able to do. I mean, not that you're trying to stop them, but, just a little opposing pressure. After going through and checking the cervical spine, you're also going to check the paravertebrae, moving down, make sure you've palpated the trapezius. You're going to go all the way down and assess the thoracic and lumbar spine. Once again, checking asymmetry. Is there any deviations? Is there bruising, tenderness, redness? And going through, making sure it doesn't hurt the patient. If there is tenderness, maybe they have a fracture. You should just be aware of all the things that could be possible if something abnormal presents. So normal curvatures of the spine that we talked about, as far as the lumbar curvature that goes inward, and noting if it's an elderly patient and maybe they have kyphosis, which also would protrude, it's kind of like protrudes the neck and head forward, while the thoracic's upper part of the back there kind of comes out. And that we see it on a lot of older people, just from poor posture over many, many years and not doing anything to fix it. And then after going and visually assessing and palpating, you can then move into doing your range of motion exercises. And it's important also to know that, like with obese patients or maybe pregnant women, that they might also have a curvature, lordosis, something of that sort. I can't remember the name exactly, but lordosis. There we go. And so you also want to be aware of, for each patient, what should be expected or what could be expected normal for their circumstance. And so after going and doing your visual inspection, your palpation, making sure that you know anything abnormal, any step off, crepitus, deviations, you would then want to also percuss. And that would be how you kind of, test for the tenderness of the spine there. And low power mode. And then after moving into that, you can go into the range of motion exercises, planing forward, backwards. The expected flexion is about 75 to 90 degrees, and the expected hyperextension is about 30 degrees. Then you would also consider the lateral to each side, and that's about 30 degrees or 35 degrees that you could get to each side for the normal being. And that's just for the movement of the upper trunk here, obviously, because you're kind of more so maybe about 35 degrees. Anyways, then moving on from the thoracic and lumbar spine, we want to go and assess the hips. While we're assessing the hips, when we do our visual inspection, we're going to palpate, we're going to feel the top of the iliac crest. We're going to go all the way from front to back, assessing any tenderness, deformities, if there is ecchymosis, any of that. And if it's causing the patient any pain, definitely try not to continue to assess that area. We don't want to purposely cause them pain when we know that they're already going through it. So then we will go from inspection to palpation to then our range of motion exercises once again. In doing so, you can do the circumduction. You're going to do internal and external rotation of the leg. You can't see it, but I'm doing them. And also extension, hyperextension, and flexion. And then moving from your hip, what you'd want to do is move to the lower part of the legs, knee, hip, to your quad area, thigh, and to the knee once again, inspecting, palpating, and making sure that muscle stability is there. Obviously, your muscles help support your bones, so we want to make sure that you've got some good strong muscles to carry the rest of your body and keep normal functioning. You would palpate around the patella, make sure that, the femur, everything feels good, tibia and fibula, and moving down to the ankle, you want to also palpate the, before I move on, range of motion exercises for the knee. You could apply opposing forces, really just flexion and extension on there. And then you can move down to the Achilles, palpating that, making sure there's no pain, no dislocations, no, muscle disconnecting. You don't have any torn ligaments or tendons or muscles. All that, the patient would probably experience more pain. You don't want to cause them more pain, so probably be a little more gentle, or don't palpate areas that they are already hurting. Once again, ankle and foot, going through the inspection, palpation of all the bony prominences, making sure that everything is intact and as it should be. Floating bones such as the patella or ankle are there, you're not able to move. There's so many bones in the foot area and the ankle that you want to make sure all the structures are in place. not a whole lot of deviation or movement when you're palpating, and that it's not causing any pain. You want everything to be secure. And then you move into your range of motion exercises, rotation, flexion, extension, hyperextension. I don't know if you can really hyperextend there. Yeah, you can. And I believe that might be it. After a 20-minute video, I think it should be. And after you're finished doing your full inspection of the musculoskeletal system, make sure you document, make sure you cover your patient, that you leave them in a position of comfort, and that there's not anything else that might need to be done with them. And before you leave, just make sure you perform hand hygiene and they've got your call light.